So when we take out teeth, there's just two things we worry about. One is pain, the other one is bleeding. Okay? So in terms of pain, I need you to go home and take 2 Panadol as soon as you get home. Because whilst you're numb, you're not feeling the pain, but as soon as the numbness wears off, it's actually much harder for the Panadol to work. So you want the Panadol to already be in the system, already working. I find that having 2 teeth out, the Panadol sometimes alone is not enough. So for the rest of today, so maybe the next 24 hours, we get you to take Panadol every 4 hours, Nurofen every 4 hours. So they're alternating what you're taking. So when you go home, take 2 Panadol. In 2 hours, take 2 Nurofen. In 2 hours, take 2 Panadol. You just need to do that for maybe the next 24 hours. After that, maybe just go back to taking Panadol. Okay? Have you had teeth out before? How did you go after?
Oh, fine.
It hasn't been too bad?
Not too fine.
Okay.
I've never had, because you can get the white, is it a
Dry socket.
Yeah.
So there's a condition that happens to 10% of getting teeth out.
I've never had that before.
Sure. Patients who smoke are at a higher chance of getting dry
Yeah.
socket. And typically with dry socket, what happens is that the teeth gets better, and then for whatever reason, the clot comes out, and then they're in a lot of pain. So the dry socket doesn't happen straight away. It's always a couple of days later. So if that happens, call us. Okay? So in terms of pain, take painkillers for as long as you need. Okay? But today, Panadol, Nurofen. To minimise discomfort, don't eat on this side, don't brush on this side. You're going to be fine to not brush for a couple of days. Okay? And soft things like pasta is okay. You don't need to be on a soup diet. Okay? And in terms of bleeding, you need to bite on the gauze for the next 20 minutes. Okay? We'll give you some spare ones. If in 20 minutes it's still bleeding, put another one in. And if you do run out of the gauze, tea bag is a very good alternative. Okay, so with tea bag, just wet it under the water and just bite on it. The tannin from the tea prevents bleeding as well. So there's no stitch in your mouth. You don't need it for simple extraction. So everything should be there. I don't think it's going to apply to you because we took out 2 teeth side by side. Sometimes there's a bit of bone between 2 teeth. Okay, that bone, it's not, it's still intact in your mouth. So if you do put something in there, it can be a bit sharp in there. But over time, as that all heals over, that bit of bone sort of it'll smooth over. So the bone will smooth over. We don't go in there and take it out or anything. So this is the rest of the generic instructions. We want you to take it easy. Certainly don't work up a sweat. No alcohol, no smoking for the next 2 days. Any questions?
No, I think we're good.